it is very important to understand that radiologists see visceral fat every day. We do see visceral fat every day. And in fact, when a patient does not have much visceral fat, the study becomes a little bit more challenging to read because everything is more crowded in your abdomen. So we kind of like visceral fat, quote unquote, because visceral fat makes things easier to see because it's just displacing everything and the organs are just floating in the ocean of visceral fat, like Sean says. I have never learned to describe visceral fat in medical school or during my 2 radiology residencies and during my body fellowship. And again, it's not because radiologists cannot see visceral fat or are not trained in reporting visceral fat. It's just because it is something that we as radiologists just go through it as if it's normal. Almost everybody has visceral fat now. When you don't see visceral fat, this study is harder to read. And that's sad. It's sad because we sit in conferences day in, day out that talk about Alzheimer, which is now quoted as diabetes mellitus type 3, that talk about diabetes, prediabetes, and talk about fatty liver, and fatty liver evolving to inflammation in your liver, and then cirrhosis, and then liver cancer. And we sit in conferences discussing liver cancer and all these amazing treatments that exist for liver cancer, but we don't step back. And that's why I'm here, because I want to bring awareness together with Sean and Omara and all the other doctors that are talking about health optimization. My goal is to bring awareness for all my radiologist colleagues that how about we step back? We start describing visceral fat in all the scans we are reading, since it has been proven that visceral fat is the root, is the cause of the majority of these things, right? So visceral fat leads to insulin resistance. Visceral fat leads to prediabetes, diabetes, fatty replacement of the pancreas. Visceral fat leads to, it has been proven, like fat around your heart and cardiac abnormalities in conduction. Visceral fat can be a cause, is studied to be a cause of mental disorders and dementia. Visceral fat, I'm citing everything in your body from head to toe. Visceral fat can give you like fatty liver again, inflammation in your liver, cirrhosis, liver cancer. Visceral fat has been linked to autoimmune diseases. Visceral fat has been linked to inflammation in your body that leads to cancer. So, and the patients who have visceral fat, if they are obese, they also are in the class of people that are more prone to have colonic diverticulosis or stones, gallstones, and the fat in your pelvis makes your organs to be more relaxed. So then you're going to have something that it's called pelvic organ prolapse that is responsible for incontinence in women. When you have visceral fat and you have metabolic syndrome, then you start replacing your muscles with fat, which Sean calls so well the marbling of the muscles and the sarcopenia. And that's another thing that I want to bring awareness, is that it's very important to follow these strategies to optimize your health. My goal is I want to be 70 or 80 or even more, but I want to be functional. I want to have a functional body. There is ice here sometimes and I fall. What do I want from my body? I want my body to fall in a way that I'm going to get less hurt, or I want myself to be able to fall and stand up alone. That's the sarcopenia, that visceral fat and being sedentary and allowing your muscles to be replaced for fat. It happens. You don't have to have cancer to have that, right? And the MRI is such an important tool because it allows us to see the visceral fat and allows us to see also the muscle replacement by fat. Sincerely believe that the MRI is a better marker and a better way to evaluate for visceral fat than if you do a DEXA scan that gives you your body fat mass. It's because the DEXA scan is going to tell you, like my DEXA scan, oh, you have 44% of fat in your body. 44% is a super big number. But I have, it stays there in my brain and then boom, goes away, and I don't think about that very much. And then I remember that my bones are good. So it kind of, plays with your brain. But when you are with your MRI in front of you, like I was with my MRI, I even have like chest tightness right now. When you have the MRI in front of you and you see that your abdomen is mainly filled with visceral fat, and that the visceral fat is like surrounding all your organs. And then I was able to see how little of musculature I have in my abdomen, how the musculature that sustains my body along the vertebral bodies of my thoracic and my lumbar spine are already diminished and replaced by fat. Or I am able to see in my thighs the marbling, like Sean says, that looks like a steak that we're going to eat. And I am in the back of my mind thinking, I need my legs for me to walk. So yes, the MRI has this huge impact on engaging your vision, engaging you really feel in your heart, you feel in your body, like the senses connect. And like I said, just by talking about it, I feel this tightness in my chest because I know that I am way far from being healthy. The good thing is it is reversible. It is reversible. You can build muscle. You can burn your visceral fat. And I love saying the word burn the visceral fat because it makes me feel empowered, powerful, because our body, thank God, has the ability to replace the cells on their cell cycles for each organ, right? So for the skin and for the liver and for the blood cells, we have a cycle in our body that replaces that. We only describe, like, we are trained in medical school and in the radiology residency, and I believe in other residencies too, we are trained to focus on the disease and how to treat and how to report in the better way. Like a scan comes to me for me to read the scan, a CT chest or a CT abdomen or an MRI, and I am trained to describe for you the positives, right? Do you have cancer? Do you have inflammation? Do you have any finding that is important for you to follow up? But visceral fat got so ingrained that it's normal. Everybody has visceral fat, and I don't know why, to be honest, since we now know that visceral fat is the root, the cause of all these other things. But it's just like if the visceral fat doesn't have a tumor growing on it, like a sarcoma or something, we're not going to describe it. We describe the sarcoma, we describe the liver, the fatty liver, we describe the fat in the pancreas. But like I was discussing with another radiologist, and he said, Anna, but if I'm going to describe visceral fat, I'm going to describe visceral fat in all my reports. Yes, we are, because unfortunately we are living in a pandemic of obesity, right? When I started describing, and I'm describing now for maybe 3 months, when I started describing visceral fat in my reports, it became present in at least 95% of my scans. At least of the people have visceral fat, and including the people who are what we call TOFI, which is thin outside and fat inside. People who believe that they are healthy and they are not healthy at all. They are metabolic unhealthy. They do have lots of visceral fat, which is a biomarker that needs attention because, again, like I said, it's metabolic active and it's going to create inflammation in your whole body. But I believe that by describing it, we also are going to overwhelm the providers who are ordering the scans. And then people are going to start doing the preventative measurements, the health optimization strategies, and we are going to be advocating for health. So I say metabolic, and it says, and usually it's when I say mediastinal fat, visceral fat, fat around the heart, pancreas replaced by fat, fat in your liver. So when I say these things in the report, in the end I say constellation of findings are concerning for visceral fat. And then I put, this could be associated with a range of long-term metabolic complications and reversible, because it's really important to understand that this is reversible for the providers and for the patients who will get access to their report. And reversible with lifestyle strategies such as low-carb foods, no processed foods, high-intensity exercises, strength training, and some kind of sprinting activities. I change this sometimes for patients according to their age, or if it's a patient that is 80 years old or more. And unfortunately, I see that the patient has lots of comorbidities like an aneurysm of the aorta, an aneurysm of the thoracic aorta, or important vascular calcifications, or an enlarged heart. I kind of stop here in the strength training. I don't put the sprinting activities because I don't want, again, do no harm. Patients with visceral fat also have lots of peripheral arterial disease, so severe vascular calcifications, problems in your heart, problems in your aorta, and some of them can't even walk very well because of the vascular insufficiencies, right? So each person is unique, each patient is unique, and each treatment and each plan is tailored individually, right? We have to remember that.